Hello, I'm Dr. Matthew Jansen, a maternal-fetal medicine physician at Penn Medicine, Pennsylvania Hospital. Today, I'd like to discuss gestational diabetes and what you can expect during your pregnancy. During pregnancy, your body can have difficulty regulating blood sugar levels. Some patients develop high blood sugar levels during their second and third trimesters. This condition is called gestational diabetes. Uncontrolled gestational diabetes can cause your baby to grow larger than expected, which can lead to complications during delivery. High blood sugars can also affect your baby after birth and cause difficulties with their own blood sugar control. In some cases, your baby may need to spend time in the intensive care nursery. However, it's important to know that with proper screening and treatment, we can help to prevent these complications. During your pregnancy, we monitor your body's blood sugar control in two important ways. First, at your initial prenatal visit, we check your hemoglobin A1C to see if you're at high risk for developing gestational diabetes. Then, around 26 to 28 weeks of pregnancy, we perform a two-step gestational diabetes screening. The screening process begins in the first trimester with a hemoglobin A1C test, which shows us your average blood sugar over the previous 3 months. Later in pregnancy, we perform a 1-hour glucose challenge test where you'll drink a solution containing a specific amount of sugar and we'll check your blood sugar afterwards. It's important to understand that this initial 1-hour test is just a screening test. A positive result does not necessarily mean that you have gestational diabetes. But if you do test positive on this initial screening, we'll conduct a more comprehensive 3-hour glucose test, where we check your blood sugar multiple times to accurately diagnose gestational diabetes. For the initial 1-hour test, we recommend nothing to eat or drink for 1 hour prior to testing. If you need the 3-hour test, we'll ask that you fast for 8 hours beforehand. You can expect to hear from our office within a few days after your test. For your convenience, your results will also be available through your Penn Medicine portal. If you are diagnosed with gestational diabetes, we will schedule you to meet with our Diabetes and Pregnancy program and provide you with comprehensive information about starting a specific diet, along with other resources to help control your blood sugar. We'll give you a glucometer to check your blood sugar 4 times a day in the morning when you wake up and 1 hour after meals. This monitoring helps us ensure that your treatments are working effectively. Depending on your blood sugar readings, some patients may require medication or insulin. Gestational diabetes screening is one of the many ways we work to ensure that you have a safe and healthy pregnancy. At Penn Medicine, we're here to support you every step of the way.